A lot of you have been writing to us wondering why we've not been doing stories on the AstraZeneca blood clot controversy. The answer is quite simple. We do not know enough. Well, no one does. Some claim the AstraZeneca vaccines are unsafe. Then there are others who contest the claim. We do not believe in peddling half-baked information, let alone spreading vaccine fear. And that's the reason we've been waiting for more data before we could talk about the AstraZeneca vaccine controversy on this show. So here's what we will do tonight. We'll try to answer 5 questions that most of you have asked. Number 1, what is this controversy all about? Number 2, what do the numbers say? Number 3, what do the experts say? Number 4, are vaccine side effects normal? And finally, what should you be doing? Taking the vaccine or not? And we'll take these questions one by one. We start with the controversy. What is happening around the world? European nations like France, Germany and the Netherlands have suspended the use of AstraZeneca vaccines on people below the age of 60 years. Canada has limited the jabs to those above 55 years of age. Denmark and Norway have suspended the use of AstraZeneca altogether. Why? Because of reports of rare blood clots in the brain. What about India? No such case has been reported in India. No cases of blood clots linked to the AstraZeneca vaccine have come to light or been reported in India. But there are some cases in the United Kingdom and the European Union. It's known as the cerebral venous sinus thrombosis. Some experts fear it is linked to AstraZeneca vaccines. Is there evidence? The European Medicines Agency says it has found a quote-unquote possible link between the vaccine and the blood clots. All those who reported the blood clots had taken the vaccine a couple of days or weeks before this report came out of them having blood clots. Now, most of them were young and middle-aged women. The latest development is from the UK, where a trial on children has been paused, again because of the fear of blood clots. Question number 2, what do the numbers say? How widespread is this vaccine-related clotting? So far, 62 cases of these blood clots have been reported worldwide. 44 of them are in Europe. This includes the European Union, Iceland, Liechtenstein and Norway. How many AstraZeneca vaccines have been administered in this region? 9.2 million. So that's 44 cases in 9.2 million. A minuscule figure in terms of percentage. Now let's take a look at Britain. 18 million people have been administered this vaccine in the UK. 30 cases of blood clotting have been reported so far. Of them, 7 have been fatal. So 7 deaths, 30 cases in 18 million. Again, a very tiny percentage. What do these numbers tell you? Well, they do not rule out cases of blood clots. But what they do point at is the rarity. The numbers are very small. Question number 3, what's causing these blood clots? What do the experts have to say? Investigators in Europe have put forward 2 theories. One, that the AstraZeneca vaccine is triggering an unusual antibody in rare cases. And possibility number 2, the cases of blood clots may be linked to birth control pills. Again, none of these theories have been proven. Here's what European Union's drug regulator has to say on this.
The Pharmacovigilance and Risk Assessment Committee of the European Medicines Agency has confirmed that the benefits of the AstraZeneca vaccine in preventing COVID-19 overall outweigh the risks of side effects.
What does the World Health Organization say? It says the AstraZeneca vaccine is safe. We spoke to some medical experts before we could talk to you about the controversy tonight, and they said when it comes to vaccines, benefits outweigh the risks. Remember this. There are 2 things they pressed upon. One is the rarity of the cases. Blood clots are indeed rare. And point number 2, the need for more data and studies into these cases of blood clotting. Why? So that experts can segregate the group that is showing an adverse effect to the vaccine, so that doctors can warn people with certain medical preconditions, certain comorbidities against taking the AstraZeneca vaccines. They could opt for other Wuhan virus vaccines. The next question is this. Are side effects to vaccines normal? Yes, certain side effects are, like pain, swelling or redness in the area where the shot was given, mild fever, chills, weakness, diarrhea, vomiting, muscle and joint aches. Experts say that such side effects are a sign that our bodies are starting to build an immunity against the disease, so do not worry about them. Side effects may differ depending on your age, your gender, and your medical history. You see, a vaccine helps you build immunity by imitating an infection. Your body is basically being infected with a living but weakened virus. So your body is reacting to it, and that is normal. But yes, if any of these side effects stay for too long or become severe, you must see a doctor. What about the blood clots? Here's what the European Medicines Agency said earlier this evening.
Prague, after a very in-depth analysis, has concluded that the reported cases of unusual blood clotting following vaccination with the AstraZeneca vaccine should be listed as possible side effects of the vaccine.
Possible side effects of the vaccine. So it all comes down to one question. What should you do? Should you take the AstraZeneca vaccine or not? Well, numbers say blood clots are real, but they're also rare. Experts say the benefits outweigh the risk. So again, what should you do? For starters, do not listen to uninformed advice. It is being generously dished out on WhatsApp groups and social media. Instead, consult your doctor. Only a professional will be able to take your medical condition and history into account and tell you whether or not you should be taking the AstraZeneca vaccine. And remember, for most of us, these vaccines can prove to be lifesavers. When your turn comes, do take the shot. WION is now available in your country. Download the app now and get all the news on the move.